failure is a condition where either your heart doesn't pump well or your heart doesn't relax well. 50% of patients that have heart failure have something called heart failure with reduced ejection fraction, and that essentially means that the heart doesn't pump well. The pump has failed. The other 50% of the patients have something called heart failure with preserved ejection fraction, meaning the pump is just fine, but when the heart goes to relax, there's a problem with the relaxing.
So the most common symptoms of heart failure are shortness of breath. You may also have swelling in the legs. You may just feel very fatigued as well.
While you're asleep, you get up in the middle of the night gasping for air. Or all of a sudden, you can't lay flat. You need to now sleep with 1 pillow, 2 pillows, 3 pillows. And we always ask patients, how many pillows are you sleeping with tonight? It's a weird question always. They always ask you why, but it gives us a lot of information.
The first thing we need to figure out, well, what caused the heart failure? In America, the most common cause of heart failure is heart disease.
Coronary artery disease leads to heart failure by blocking blood flow to your heart muscle. Not having blood flow to your heart muscle weakens that muscle and can even kill that muscle. And now you don't have that part of that muscle contributing to that ejection fraction or that strength of that pump to push blood forward.
If it's not that, then there's an entire laundry list of other things that can cause it. For example, a patient that has a problem with their valves, a patient that has a problem with arrhythmias, abnormal heart rhythm, patients that have excessive alcohol use or use drugs, patients that have high blood pressure, diabetes.
If a patient is on a chemotherapy agent, particularly for breast cancer, for example, that could also weaken the heart. In order for us to treat you and help you have full recovery of the muscle of the heart, the goal is really to figure out the cause or the underlying etiology of why your heart muscle is so weak.
You can diagnose heart failure many different ways. You can start just by doing a physical exam to see whether or not there's evidence that the heart isn't pumping well or the heart's not relaxing well. You can do an electrocardiogram that tells you exactly how much the heart is pumping, how much blood is getting out with each beat, how the heart is relaxing, and what those valves look like.
I think people think of heart failure as a condition where it's doom and gloom and you're just going to be bedridden. And that's not the way it is anymore because we have multiple medications that can work to improve symptoms and in some cases improve heart muscle function.